November is Diabetes Awareness Month, and right now we are hanging out at the Canadian Diabetes Association right here in Saskatoon. I am joined by Lauren, and she's going to tell us what is diabetes. Just define that for us, Lauren.
Well, there are different kinds of diabetes, but basically what we're talking about is an insufficient use of insulin.
Okay.
So our pancreas either isn't working the way it's supposed to be, or we're not receiving the insulin the way that we're supposed to be.
Okay, so with these many different types of diabetes, what are some of the more common diabetes types?
Usually we talk about type 2 diabetes. That's the one that we hear a lot about in the media.
Right.
That's actually about 90% of the people who have diabetes are type 2.
Okay.
But there is also type 1.
All right.
There is another condition called pre-diabetes. And for ladies who are pregnant, there is another condition called gestational diabetes.
All right, perfect. So let's focus on type 2 right now. Let's say someone has no idea that they may or may not have diabetes. What are some of the signs or symptoms that people can recognize to see maybe they should get tested and figure this out?
Okay, well, there are certain risk factors. If you have diabetes that runs in your family, that's a huge risk factor for people.
Okay.
As we get older, we're more at risk for contracting diabetes because our pancreas gets older just like we do.
Okay.
If you're feeling extremely fatigued, if you notice you're going to the washroom far more often than usual, if you are drinking far more water and seem to be much more thirsty than usual, these are all some really common signs and symptoms.
Excellent.
Unfortunately, with type 2, there are sometimes people who don't display any symptoms. It's kind of an insidious disease. It sneaks up on us. So that's why it's really important to get the awareness out about things like risk factors and about getting tested.
Excellent. So let's talk a little bit about, now that you've seen these symptoms, how should people go about getting tested or get information about that?
If you have a family doctor and you're going for your annual physicals, you can ask for that to be part of your annual physical and your blood work.
Perfect.
If you're interested in getting tested right away, you can go to many doctor's offices and they can do the blood work there.
Okay.
You can also do things to learn about your risk factors, like going online to, right now we're running a campaign called Don't Be Risky.
Yes.
And that's don'tberisky.ca, and you can run through a risk factor online just to see what do I all have and what do I need to be aware of.
Okay, perfect. I'm just curious about this. You know, a lot of people I've talked to are like, well, if you eat so much sugar, you know, you're bound to get diabetes. Is that myth?
You know, I'll say it's a little bit of both.
Okay.
It's a balance of a lot of things. Diabetes, we can't just chalk up to one thing and say that we just blame it on sugar.
Yes.
There's lifestyle factors, there's plenty of dietary factors. Like I said, there's some other risk factors like ethnicity and age that are things that maybe we can't necessarily control.
Right.
So it's about leading a healthy lifestyle, including not eating excessive amounts of sugar, but eating, you know, lots of fruits and vegetables and focusing on our whole grains and our low-fat products.
Excellent.
It's also about being physically active and leading an overall healthy life.
Absolutely. All right. Well, there's lots more learning happening here at the Canadian Diabetes Association, so don't go anywhere on today's Go Saskatoon.